Uh, Good evening, everyone. Thank you so much for the opportunities to speak about the preventive health specifically. Uh, okay. Let me take another couple of minutes to talk about the story of Lakshmama. She is 60 years old and she lives in Bammanahalli, Bangalore South area. And she has been diagnosed with diabetes as well as hypertension, but the last test was done almost 8 months ago. But no one is following up, and she has been taking medication, but whenever the symptoms are increasing. Okay, so at a time she had a stroke and admitted into hospital, and the family has to borrow money and again trapped into the debt. So it's not about system crack there, but it's also about it was not built for her. So basically what I'm saying, the system is there, health system is there, but at the same time system is not really meeting the requirement of the community. So like the Lakshmama, there are millions of people who are experiencing these kind of challenges. This is just to give you a the glimpse. We know that Bangalore is rapidly growing. The interesting data what we seen is every day 1,000+ people, the residents added to the Bangalore. So inflow is increasing, but at the same time we are not coping up with that kind of the required health infrastructure and also preventive health mechanism that needed for communities to live. I think you can see that two trends here. One side you see health system, another side you see the neighborhood. The health system, there are hospitals, there are clinics, there are pharmacists, there are the specialists, either private and also the public sector. But at the same time, the neighborhood, where you can see that where people are living, right? The Lakshmama, again diabetic, and her son is a Raju gig worker and no health insurance at all, despite having access to health insurance. And Priya is anemic, Raju's wife, and child is missed vaccination. But we also interestingly see the gap in terms of the lack of continuity, poor trust. Many people the bypass public health center because of various reasons, and also the lack of relationships, and the poor safety nets for people. Of course, the below poverty line we have government health insurance, and above the rich people having their own insurance because they can offer. But at the same time, many the people who are in the middle, they do not have access to the health insurance. This is give you just another glimpse of the data. The panelists had a deep dive in terms of how NCDs are affecting the people in Bangalore. Of course, these are the few data where I thought of presenting, but at the same time there are many health issues still we can dip. And another interesting point you can notice here, 70% of the people paying their out of pocket, which is really alarming. And altogether you see the more than 50% of the cases are undetected, are undiagnosed, hidden. We live with that. I think that's the aspect we should keep that in mind. Let me introduce a character of Sunita here. Sunita is a health worker, and she has a system. The system flags the reminder where she wants to meet the Lakshmama. She visits and she do the health interventions. And during her visit, she found the Priya, her daughter-in-law, having exhausted, looks exhausted, and Sunita asked how she is doing, and Priya reported tiredness and almost in the past few months. Then the testing was done, hemoglobin test, and her hemoglobin was almost 9, which is low. The efforts of Sunita is about the Lakshmama's medication sorted out, and Priya's anemia testing is done and treated with the proper medication, and child's vaccination is also updated. So in this case, nobody went to hospital and nobody paid out of pocket. But after 2 months later, the both are really doing good. So this is a kind of reimagined health intervention by the Sunita. The right hand side, where you see the picture where we have community health workers from the community being trained. They have a the digital innovations to do the testing at the primary level, do all intervention at the primary level in order to ensure prevent people from diseases. This is just to give a glimpse of in terms of how people system, the centered systems work. It's not about keeping system at the center, but here we are keeping the household or people at the center, do intervention around. So everyone play the enabling role here, including diagnostics, the medicines, PHC, health worker, and digital innovations, etc. should be navigated to towards the household, rather the system expecting communities to come. It's the ideal, but at the same time it may not happen situation like Bangalore. So in Swasti, what we do, we look at the Rasta strategy, go to community, onboard every family, every individual at the family, do the risk assessment, do the screening using point of care diagnostics, testing. People require further testing will be navigated, but at the same time proper treatment, timely treatment, as well as active follow-up, which is very critical. I think during the panel discussion, there was a deep dive around the social determinants of health, social and commercial determinants of health, including the the climate health impact on the health as well. So which is very much needed. The health workers, what we have, they look at everything from the bottom to end. But when any people require further navigation support, those people are navigated to nearby public health system. That's the core work they have been doing, along with addressing some of the social determinants of health, including financial literacy, facilitation of social protection schemes, because in India we have more than 1,000 schemes, at least I could say more than 250 schemes are working, and including the government health insurance at state level as well as the central level as well. This is give you a glimpse of in terms of how people-centered primary healthcare works, as well as the patient's journey. Ultimately, the outcome that we look at is about improved clinical outcomes, reduced hospitalization, lower out-of-pocket expenditure, as well as equitable health access, timely and the equitable health access. This is, I think, over and over, our governments have been invested in generally secondary and tertiary care, hospitals, infrastructure, which is good, but at the same time, the cost of the health is higher, right? When you invest little bit on the prevention, definitely the cost of the secondary and tertiary care will come down, but at the same time, the morbidity and also the health issues also will come down over the period. I think that's the graph that summarizes. I kept it as reimagined, of course, in some states and some districts are happening, but at the same time, long way to go to reach that milestone. I think these are the few data points or the exemplars I would like to say here. In Brazil, you see the 40% reduction in infant mortality because of people-centered primary health care, and in Thailand, 60% catastrophic health expenditure has been reduced, and at least 80 to 90% of the health issues can be addressed at the primary level, household level, if you have proper preventive healthcare model designed for community, not designed for health system. So one more thing, what we do, any program we design with the community, understanding the lived realities of the communities and see what works best for them. It's not about what works for us. Yeah. This is another Bangalore, the I4V program, Invest for Wellness program, what we have been implementing in multiple locations. This is a learning lab for us where we are learning here, and also we are also working with some of the governments, the cascading these learnings and also outcomes, so that governments can also adapt some of the framework and also the tools that we created, so that it's not that we do everything, but at the same time we can do it together, because government has capacity to scale as well. Yeah, this is I will end with health, the health is not another any single or in a government's business, but it's also about everyone's another business. So we know that there are many people, many the vulnerable communities. They have been supporting us and making our life easier. But at the same time, how we can support them, remind them about that testing, the prevention, and accessing health insurance, etc., so that their the life is also healthier and also happier. Thank you so much.